Good afternoon. My name is Dr. Vijay Agarwal. I am the Chief of Pediatric Cardiac Surgery and the Program Director for Fortis Hospital, Mumbai. India is actually on the way up in its graph, and considering that pediatric cardiac surgery in India is very, very young, we've actually made rapid strides in this field. To give you an example, most of the pediatric cardiac surgery as less as 8 or 10 years back was concentrated in the city of Delhi and in south of India. But now one has, in the last 5 or 7 years, we have had centers in east of India, west of India, and a lot of centers have also come up in the north of India, therefore catering to the large population of children who suffer from congenital heart disease. So in that sense, the facilities to address a very serious problem uh, is getting tackled in a much more efficient manner. In terms of expertise, India was always extremely good. In fact, a lot of the surgeons who are actually practicing in Europe and in America are of Indian origin. And so skills were never a problem. It was only the awareness that pediatric cardiac surgery has to be brought into the table for the rest of the population was not there. The infrastructure was not there. And in those terms, we have had actually a lot of progress. Having said that, we still have a lot of long way to go. The volume or the disease load was always there. Roughly about 1.5 lakh to 2 lakh children are born in India who have congenital heart disease. It is actually more common than Down syndrome, which a lot of people are aware of. But the awareness for congenital heart disease is very less. And out of these 1.5 or 2 lakh children being born in India every year, the whole of India, only 20,000 to 30,000 operations are being done. Which means what? Which means that there is a lack of awareness, there is a lack of infrastructure and facility to address the rest of the children. And these children are ultimately and unfortunately dying. And you will be surprised to know that 80 or 90% of the heart diseases in children can be virtually be cured. That is, if you operate on them at the age of 3 months or 4 months or 6 months or a year, you will have a normal lifespan. So it is a bit sad that so many children are actually dying without an operation for something which can be cured. Um, Things are improving, and I think because of the increase in the infrastructure and more hospitals being built who cater to pediatric cardiac surgery, um, we are actually able to treat more and more children. But there's still a big lacuna because we need much more centers who can do many more operations to cure congenital heart disease. Of course, one of the challenges of this is the lack of awareness, not only from the parents who think that it is a highly risky operation and cure is not possible, but there are financial issues as well, because these children are born to young parents who are starting their career. They may not be very financially sound, and therefore they come to the doctor very late for the treatment also. So there are various challenges in this. From the doctor's perspective is a good question actually. Um, Pediatric cardiac surgery requires a lot of skill. It also requires a lot of infrastructure. So the challenge which I see in terms of the infrastructure is very, very important. One can do a very good operation, but if the infrastructure is not there to support the child in the post-operative care, you will have a bad result. And that is sometimes what is unfortunately happens in centers who do not have a proper infrastructure. So I think that is one important bit. One can do pediatric cardiac surgery, but if you do not have a good support staff who are highly skilled in their job and the infrastructure to support, for example, a 2.5 kilo child who has had a major operation, then you will going to have a bad result in spite of a good operation. So it is extremely important that only few centers in the city be identified and developed who can actually perform these kind of operations. In fact, in the West, in spite of a huge population in the UK, there are few centers who have been designated to do pediatric cardiac surgery. And all the smaller centers are actually supposed to refer to these higher centers. The only idea is that you get better outcomes. These higher centers they are better equipped, and people who work there become highly skilled because of the number of children they deal annually. The long-term outcome in 80% of the cases is very, very good. In 20% of the cases where we deal with something what we call as a single ventricle, you can actually extend and push the lifespan to their mid-30s and mid-40s. So it is actually overall good, but you have to operate them at the right age. For example, if you operate on a hole in the heart, which is very commonly, for example, is VSD. If you operate on a hole in the heart at the age of 1 year, and if you operate the same child at the age of 10 years, the benefit out of the operation is suboptimal in a child who's been operated late. So the outcomes will depend upon at what stage the child has actually come to you. But overall, it is very, very encouraging. The inclusion of technology is extremely vital. But when we are practicing in a country like India, it is extremely important that you also look at the disease load. And a lot of this disease load can actually be solved by simple technology which is also available to us. So there has to be a good balance in going after technology as well as using the current technology to have maximum output. To me, it is important that we know where we are practicing and we know what is our priority. At this point of time, as far as my philosophy goes, we have huge disease load in the community, and that can be solved by the current technology. But nevertheless, chasing technology is always going to be beneficial and is always going to push us to higher levels. In Fortis, Mumbai here, we are a dedicated pediatric heart transplant team here who are dedicated to the cause of transplanting small children. Our smallest child as of now has been a 7-year-old child who would not have lived for the next 2 or 3 weeks, and we gave her a new heart. So if you look at that, the success rate of heart transplant is quite good actually. What is called as a conditional survival, if the child is able to survive for 1 year of transplant, then the conditional survival is almost 80% at 20 years. So that I feel is an extremely good result, because otherwise without the heart transplant the child would not have lived for next 2 or 3 months. So doing a heart transplant, and the success rates are actually very good. Obviously one has to take the medicines on time, the immunosuppressive agents, because these children are very prone to infection, especially in the first year of life. So obviously there are challenges associated with pediatric heart transplant, but it could be life-changing.